Hi, everybody. Or I guess it's good afternoon, right? Sometimes I'm not sure what time of day it even is. Um, I want to welcome you today for today's webinar. Today, I'm going to be going over Social Security and how it ties into Medicare. It's really a basic Medicare presentation. So, my take on the industry I'm in and when it comes to Medicare and health insurance, both of those are now governed for the Center for Medicare and Medicaid, CMS. And it's just not simple. There's a lot of little nuances of when you want to take out, whether you want to take Social Security, what timing's good for you. It's different for everybody. It's also different for everybody what type of Medicare plan they want to take. So what I wanted to do is I wanted to educate you guys, and I want you to participate if you have any questions. My name's Vicki Ferguson. I'm National Benefit Plans. I've been doing this for over 32 years. We started out in the industry in health insurance, individual health insurance, and always did Medicare supplements. But until about 2012, Medicare Advantage plans were not as prevalent. So in 2012, Blue Cross came to national benefit plans and offered us a contract to work with them on their Medicare Advantage plans. So for the last 12 years, I've seen the Medicare Advantage evolve and helped hundreds of people. So I believe in education. I think that it's so important that we explain everything to you. So, in my opinion, I like to treat everybody like I like to be treated, or how to treat my own family or my own mother. And I don't want to tell somebody what to do. I want them to understand their choices and, in my opinion, make an educated decision. So I'm going to go ahead and hit share my screen. And if I share my screen, I've got to find my presentation. So let's see. All right, so here we are. Let's see. Got to move my little picture and hit slideshow. This is a fairly, I'm new to Zoom. I've used other tools such as GoToMeeting. But these guys bought me Zoom, so I'm doing Zoom now, you guys. I got to tell you, I learn something new every day, and I'm learning more and more how to use Zoom right now. So today we're going to go over Social Security and Medicare 101, and just wanted everybody to get just an indication of how Social Security and Medicare kind of tie in together. So today we're going to cover just a real basic overview of Social Security, who can participate, some of the rules that come with Social Security, how they work together, and what happens when you turn 65 and possibly you're going to continue working. And then I'm going to go over some Medicare 101 type options. In other words, I'm going to explain to you what Part A, Part B, Part C, and Part D are. I'm going to talk to you about original Medicare, what a Medicare Advantage is, a prescription drug plan, explain a little bit about Medicare supplements, and then go over some of how you would enroll in Medicare. So Social Security started, they wanted to make sure that seniors would get some financial benefits as they retired. So they decided to take a little portion of people's money out of their checks as they worked, and then they put it into an account so that it was a payroll tax contribution. So it was intended so that seniors would have a safety net as they got elderly and they didn't work anymore. And if their spouse died or a mother had children, they'd have some benefits. So to be qualified for Social Security, you must be a U.S. resident or a citizen, and you must have paid into the Social Security system for at least 10 years. So when you apply for Social Security, there's some basic information you want to know. So you want to know what your full retirement age is. You don't have to wait till your full retirement age, but if you get that guide in the mail, sometimes it comes explaining what your Social Security benefits are. Then if you, that would be the amount you'd get if you waited till your full Social Security, your full age. So if you're 60 or older, or I'm sorry, if you're born in 1960 or later, then 67 will be your full retirement age. If you're prior, let's just say you're born in 59, you're born in 58, then it's like 66 and so many months. So they kind of kept moving it up as you're in the late, people that were born in the late 1950s. But if you really want to receive your benefits, you can start as early as 1962. I'm sorry, I apologize, as early as age 62. So your benefits are monthly payments that they actually direct deposit into your bank account. It's your Social Security check. And there's many people out there that are living fully on just Social Security checks. So, and that's not the full, the benefit for everybody, but you want to save money for your retirement. So if you want to continue working, then you can receive your benefits before your full retirement age, or you can postpone your benefits to even as late as age 19, or I'm sorry, as late as age 70. But at age 70, you have to take your Social Security benefits. So you would get more retirement credits if you waited till after your full retirement age. So you want to consider a few things. Everybody's different. So you want to wonder, will you continue working? Will you work part-time before your full retirement age? The reason that's important is because if you take your Social Security before your full retirement age, then there's a limit on how much income you can make, or you have to pay a portion of it back. Just a little tidbit there. I would highly recommend that you meet with your CPA or your financial advisor, or even an independent insurance agent. We can help you with some of those questions. But you also want to consider your health. So, I mean, is your family have a longevity? Do you expect to live, past age, 70, 75? Because if you really think you're not going to live past age 70, it might benefit you to take it at 62, right? So everybody's kind of different. If you think you're going to live to 90, it might benefit you to wait till age 70. The other thing you would consider is, have you saved enough money in your retirement account? You might want to continue working to add more money into those accounts, depending on your health. Health, I'm sure, is another big factor. The other things to consider: are you married? Do you have children? What's the difference between your age and your spouse's age? Are your children in college or 18 and over? So full retirement age, this slide is here to explain full retirement age. So to receive full Social Security benefits, it's called full retirement age. So if you were born, let's just say in 1958, then your full retirement age is 66 and 8 months. If you're born in 57, it's 66 and 6 months. If you're born in 59, it's 66 and 10 months. But if you're born in 1960, then it's 67 years. And right now, that's where full retirement age is at. So if you're born in 61, it's 67 years. They haven't changed that. If you're born on the first of any year, then you have to look at the previous year. So if you're born on January 1st, I'm sure there's not that many people, but if you were born on January 1st, then you would look to the previous year. If you're born on the first of the month, then your birthday is considered part of the previous month. So I just wrote an article for my blog and went over this, but let's just say you're born on May 5th. If you're born on May 5th, then your Medicare effective date is going to be May 1st. But if you're born on May 1st, then your Medicare effective date is going to be April 1st. So if you delay your retirement benefit until full retirement age, then you're eligible for your delayed retirement credits that could increase your monthly benefit. So even if you decide to delay your retirement, you still want to sign up for Medicare. So let's just look at that. So you want to sign up for Medicare, even if you're going to continue working and you're going to postpone taking Social Security. And I've got another slide to go over that. So once you start receiving your Social Security benefits, you can start receiving them as early as age 62. You're entitled to full benefits when you reach your full retirement age, which we've kind of just went over on the earlier slide. If you delay taking your benefits past your full retirement age and up to age 70, then your benefits will increase. You guys might ask, well, how much will my benefits increase? So your benefits increase about 8% per year for every year you delay it. So let's just say your full retirement age is 67 and you delay it 3 years, which would be 68, 69, 70. So 3 years. So you get 8% per year increase on your Medicare benefit, your Social Security benefit. So if you start receiving benefits early, then they're reduced a small percent for each month before your full retirement age. So to find out how much your benefits reduced if you begin receiving benefits from age 62 to your full retirement age, there's a chart that we could send you. It's also available through our office. But basically, there's a way for you to figure out if someone here really wants to talk about what happens if I take it at 64, what happens if I take it at 65, and my full retirement age is until 67, we would be happy to pull that chart for you. So there's advantages and disadvantages on taking your benefit before your full retirement age. The advantage is that if you collect your benefits for a long period of time, so that means, let's just say, if you take it at 62, you've already collected that portion of your benefits for 5 years, right, before you're 67. That could benefit somebody, especially if they didn't live a long time. The dentist's advantage would be that benefit is reduced forever. So let's just say, for example, that your benefit is $2,500 at full retirement age. Let's just say you take it at 62, it might be $1,800 or $2,000. That'll be what you'll have the rest of your retirement years, is what you take it out at. The year you take it out at, it is where it and of course they give some percentage increases as inflation increases. But that, I just want you to understand that that's how your benefit works. It's reduced for the rest of your life. So each person's situation is different, and it's important to remember that if you delay your benefits until after full retirement age, you will be eligible for delayed retirement credits that will increase your monthly benefits. There's also other things to consider when you make this decision, and everybody's situation is, I mean, a lot of it's on health. Do you want to continue working, the difference in age of you and your spouse, all kinds of things. So if you delay your benefits till after age 65, you still need to apply for your Medicare benefits within 3 months of your 65th birthday. So that means you can apply for Medicare 3 months, the month of your birthday, 3 months before. If you want to postpone or wait longer for your Medicare insurance Part B and your Part D, then you can, as long as you have qualified coverage, which means you have to have a group coverage. Your employer has to have 20 or more employees to be considered qualified coverage. As long as you have qualified coverage, it will not cost you more money. But if you, if, for example, maybe your employer downsizes and at some point they end up with less than 20 employees, and when you retire, you can't prove that your employer had over 20 employees and that you were fully insured, then it might cost you some money, more money. So how do these two work together? The Social Security Administration determines who is eligible for Social Security benefits as well as Medicare. So the Social Security Administration is basically over Medicare. They also carry the administration functions for Medicare. So Medicare is also available to people who have disabilities. So if, you guys might, some of you might actually be on this call or on this webinar and know somebody that's disabled that qualified for Medicare early. When you get disabled and you qualify for disability, 2 years after that, you qualify for Medicare automatically. So how to determine what your Part B premium? A lot of people don't know, and this is one slide I just want to share with you guys, that there's IRMA. I guarantee that is a spam call, but I won't make that. Most people don't know, or some people don't know, that there's an IRMA bracket for people Social Security. So when you take your Part B, Part A doesn't cost any premium, but it has a deductible. Part B has a premium. Part B would be for your outpatient services. So in 2025, if you make less than 105,000 singly, or if you and your spouse make less than 210,000 together, you would be charged $185 per person for your Part B premium. This chart just shows you guys what it goes up to. So, you know, if you make over 131,000 singly, if you're single, up to 163,000, then you're going to be paying $369.90 a month. So this is a way for Social Security to charge people who have higher incomes a higher premium. So Social Security enrolls you in Part A. So Medicare Part A is your hospital insurance. It helps pay if you're inpatient in the hospital and for a limited time for skilled nursing after a hospital stay. It's very important to note that you do not qualify for skilled nursing on Medicare unless you've been hospitalized for 3 full days. So Part A also covers some home health care and hospice care. So to qualify for Part A and not have to pay for it, you have to work 40 quarters or 10 years. If you haven't worked 40 quarters or 10 years, there is a cost for Part A and you can purchase it. Part B is something that you would sign up for, and Part B is what we would consider outpatient insurance. They're calling it medical insurance, but it would cover your outpatient surgeries. It covers your doctor visits. It covers durable medical equipment, specialists, emergency room. All those are covered. Urgent care under Part B. So should you enroll in Medicare if you're still working? So your employer offers health coverage. Do you still need Medicare? What about Medicare's prescription drug benefit? So this slide talks about people who want to consider working past age 65. So most people should enroll in Medicare Part A, which is hospitalization, because it's no cost and it covers you if you're hospitalized, and it will work with your group plan that you currently would have if you were on a group plan with 20 or more employees. But if you don't sign up for Part B when you first become eligible, then you have to prove that you had qualified coverage and you must have over 20 employees. If you don't, let's just say you say, you know what, I don't mind Part A because it's free, but I'm going to postpone Part B and Part D because I don't want to pay $185 a month. I'm really healthy. I'm not on any drugs. Well, the government doesn't want you to do that, or Social Security. So for every month that you aren't enrolled in Part B, or actually every year, there's a 10% premium penalty. So they'll increase that 185 by 10%. So it's really important to realize if you have qualified coverage, because once you get that increase, if you don't take your Part B when you're supposed to take your Part B, it lasts with you forever. Now the Part D drug card has it's 1% for every month that you don't have a Part D drug card is the 1% of the average cost of a Part D drug plan. So let's just say it's $33, then it'd be 1% of $33. So we're going to talk about Medicare now. Medicare has parts A, B, C, and D. So part A is hospital, part B is medical, which I call outpatient, because I think it's easier to understand. If you're inpatient in the hospital, if you're outpatient, then you have part B. If they give you drugs in the hospital while you're admitted, those are under part A. If you go to the doctor and he gives you drugs while you're in the doctor's office, that's under part B. If you go to a pharmacy and you buy prescription drugs through the pharmacy, even if they give you chemo and it's through the pharmacy and it's not given in a doctor's office, then that would be considered part D, and that would be your prescription drug plan. So that's part D. Part A and B were combined with part D to make part C. So what happened really is the government decided, hey, they have a lot of fraud, waste, and abuse. It's a big thing to manage. So they decided to give private medical insurance companies the ability to provide insurance for people over 65. And in that it includes part A, part B, and part D. It has to cover everything that Medicare covers, and they get paid so much a month for each member. And they actually rate these insurance companies and their plans with star ratings. So you might have heard star ratings. If an insurance company, for example, gets 4.5 stars, it's equal to 5 stars. The ratings go on 1 star, 2 star, 3 star, 4 star, and 5 stars. If you do not probably want a plan that's a 3 star or lower. So the better plans are rated. They have a formula where they look at how well their customer service is, how their care is, how happy the members are, and they go through and they rate these plans. So it's something to remember if you're going to be considering taking a Medicare Advantage plan out. You might just want to ask what the star rating is. So part A and B are what we call original Medicare. So if you guys are turning 65 and you say, well, why can't I just keep the original Medicare? By all means, you can have original Medicare when you turn 65 and you, if you already are pulling Social Security, let's just say you took it early, you'll get your red, white, and blue card 100 days before your birth date. Okay, so you can look for it to come in the mail. If you're still working and you're not taking your Social Security or you haven't applied for it yet, you'll have to apply for it. And then once they approve it, then you'll get your red, white, and blue card after that. You have to have Social Security part A and B to get, well, you don't have to have B. You'll just get a red, white, and blue card with just a part A date if you postpone your part B. If you get your card in the mail, let's just say you've already taken your Social Security and they mail you your card and you want to postpone your part B. On the back of that card, it says, if you want to postpone part B, call this number. So I just want to mention that. So now you have original Medicare because you have to have part A and part B. You can keep original Medicare. It's not a problem. You have 80% coverage. So if you were to go to the doctor and the doctor was $100, you'd pay $80, or I'm sorry, Medicare would pay $80, you'd pay $20. If you were to go to the hospital and you had a $100,000 hospital claim, Medicare would pay $80,000, you'd be responsible for $20,000. The Medicare supplement plan is what gives you the coinsurance of that 20%, right? So a Medicare supplement is a supplement to original Medicare. It's not a Medicare Advantage plan. It's what you call a supplement. Some people call them gap plans. So in other words, you keep your red, white, and blue Medicare card, the original one they send you that has your part A date, your part B date. Most people's part A and B dates are the same, but if you continue working, your part A date might, let's just say, be January 1st, 2025. You work 2 more years, your part B date might be February 1st, 2027. So just so you know that. But if you do take your red, white, and blue card and you want a supplement, then you would buy a Medicare supplement. The Medicare supplement covers the difference, the 20% that Medicare doesn't cover. Then you still need to get a drug card, which is part D, because the drug card is not included with the supplement or original Medicare, which is A and B. So here, this slide's got Part C. So you can buy Part C from a private insurance company and it will include Part A and B. And as long as it says MAPD and not just MA, it'll include a prescription drug plan. But if you choose not to take a Medicare Advantage plan and you just want to keep original Medicare, even if you don't want a Medicare supplement, you should still take your Part D prescription drug plan. Now, a prescription drug plan can be as low cost as $10 a month. It can be as high of cost as $130 a month. It depends on what drugs you're on. So when it comes to choosing a prescription drug plan, it's very important that you would offer whoever you use, a licensed insurance agent, or however you're going to get your Part D drug card, you need to let them get a list of your drugs. Now, legally, I can't say I need your drugs, but I can say, would you like me to look up your drugs so I can give you a better plan, or I can make sure that all your drugs are covered under this plan. And you have to offer that to me. The really important thing here is to understand that Medicare really is trying to protect seniors. They really are. There's not everybody's a great actor out there, right? There's always somebody out there that might have not your best interests involved, right? Especially people that call and maybe work in call centers. So just make a note of that. You know, we want to have your best interest in mind. We would want to make sure that if you needed any help, you had someone to call and with claims or anything like that. Now, Part A and B is something you can keep, right? We just went over that. You have your A and B, you get your red, white, and blue card. It has your Part A date, your Part B date, and it'll cover you for 80%. This slide just shows that the other 20% is out of your pocket. So why might you want a Part C plan? Well, a Part C Medicare Advantage plan with a private insurance company, there's a lot of things to consider. Not necessarily on this slide, but I'm going to tell you out of my head here. So you want to consider the network. Network's a big deal because if you Part C plans can be HMO, PPO, HMO, POS. So the network's important. If you're going to consider taking one of these plans, you would want to make sure your doctors and the hospital you choose are in that network. Just a little bit from me. In Michigan, we're really, really lucky because we have some very large carriers with big networks. And those carriers would be our Michigan-based carriers, which would be Blue Cross Blue Shield, Priority Health, Health Alliance Plan, PHP, Trinity Health now. You know, there's a lot of great carriers that have, some of them have as many as 99% of the doctors, some have 97%. So Medicare Advantage plan in Michigan is completely different than a Medicare Advantage plan, for example, in Texas, or a Medicare Advantage plan in Wisconsin, because their network might be more regional. So just something to consider. But to take a Part C plan, it'll cover your Part A and B. It covers the same thing as Medicare, original Medicare. It has to cover original Medicare. But original Medicare does not cover dental, hearing, and vision. So what you get if you take Part C is they give you some added benefits, such as dental, hearing, vision. Some plans have gym memberships. Some plans offer things like over-the-counter, like a stipend of maybe $25 a month that you can use for vitamins. So this is each company kind of creates their own Part C plan. And I would just say on the average, most people are really happy with their Medicare Advantage plan that we have. But again, it's an individual choice. So the bottom line is Medicare Advantage combines Part A, B, and C. A, B, and D into one plan, or you can choose a Medicare supplement plan. There's plenty of options. So something to consider when you're trying to pick between a Medicare supplement or a Medicare Advantage plan is, can you afford the monthly premium? Because One thing about a Medicare supplement, it has a monthly premium, and then after you pay that monthly premium, everything usually is covered as long as it's Medicare approved charge. On Medicare Advantage plan, it's usually a lower premium, such as $0 or $16, and then you pay as you go. So you might have a copay for the specialist. You might have a copay for outpatient surgery. And the other thing is to make sure your doctors are in network. Can you see the doctors you want? You might want to consider whether you want a PPO plan or an HMO plan, depending on how you doctor, depending on if you travel. There's some fantastic Medicare Advantage plans, even if you travel, that are PPO plans that have large networks. How about the prescription drug plan? How does it pay for your drugs? Is it offered? It is only offered through private insurance companies. So your Part D drug plan will definitely come from a private insurance carrier. So basically, like I've been explaining, it seems simple, but it is somewhat complicated. You can go one of two ways when you turn 65. You can choose original Medicare, where you have Part A and Part B, your red, white, and blue card, the one they originally send you, and a drug plan, which would be a separate card. And then if you buy a supplement plan, you'll have another card. So you'd have 3 cards in that situation. Or you could choose a Medicare Advantage plan, which would take, and it takes over your red, white, and blue card. So you have to put your red, white, and blue card away. You won't need it when you go to the doctor. You don't need a drug card because it's included in there. At least most of the plans I would write would have it included, because you can't have a Medicare Advantage plan and a drug plan. So you're going to have to do an MAPD. But anyway, you would have 1 card with a Medicare Advantage plan, 3 cards with original Medicare. It's not it's not a big deal if you want original Medicare and a Part D drug card and a supplement, or if you want a Medicare Advantage plan, or let's just say you want to start out with a supplement. Maybe you have a review. We do annual reviews here at National Benefit Plan. So every year you have the opportunity to sit down with your agent and go over your plan and see if it's working for you, find out if anything's changed, if there's a better plan on the market, or maybe you need to just change your drug card. Maybe you're happy with your supplement. But anyway, that's what we do here. We don't just, write you a plan, and we want to make sure that we stay with you to help you with any types of issues or claims or payment problems. So if you do choose a Medicare Advantage plan, you have to remember there's HMOs and there's PPOs and there are HMO POSs. So basically, an HMO is you use the doctors that are in that network. And some of them, but not a lot of them, but some of them do require a referral to see a specialist. So you'd have to go to your primary care doctor. He'd have to say, oh my goodness, it looks to me like you broke your toe. I think you have to go to the orthopedic. That's a referral, right? If you go into the PPO organization and you use doctors and hospitals outside, you can go anywhere outside of your network, but sometimes it's a higher cost. So in other words, it would say, if you stay in our network, we're going to charge you $45 for a specialist. If you go outside of the network, we're going to charge you $60. You still have the ability to go to out-of-network doctors with a PPO. So how does the cost, some of the costs, how do those work out for you? So every year, these Part A coinsurance, annual deductibles, somewhat get modified by CMS. So this is 2025's numbers. So Part A, hospital deductible. So let's just say you just want to keep the red, white, and blue card. You don't want a SUP, and you're going to take a Part D drug card. If you were hospitalized, you'd have to come up with $1,676 for a deductible. If you take a Medicare supplement plan or a Medicare Advantage plan, they cover that for you. So that is not out of your pocket. Part A coinsurance, if you go into skilled nursing, after days 20, so you get days 1 through 20 is covered, but after day 21, or on day 21, I guess would be what I should say, it will cost you $214 per day to be in a skilled nursing facility, up to day 100. If you were going to have your Part B, your annual deductible for this year for Part B, it was $240 last year. This year is $257. And then your co-insurance for Part B is 20%. Some of the things that Medicare Advantage include that Medicare supplements don't include, which would be hearing exams, discounts, or some of them give you so much money for actual hearing aids. Most of them give you eyewear and hearing aids. So for example, they'll give you an eye exam, and then they'll give you, up to $200 or $300 for eyewear. They'll also, some have buy-up dental, so you can even get more dental than what the plan offers, but you get dental included. Your drugs are included. Some of your emergency medical care outside the U.S. is covered on some of these Advantage plans. And you have a maximum out-of-pocket limit. So let's just say you took an Advantage plan. You would look and consider your max out-of-pocket. So some of them might say my max out-of-pocket is $5,400, $5,200. Some of them might say my max out-of-pocket is $6,000. So you want to look at that. Now, I just would say that only 5% of the people ever meet their max out-of-pocket on a Medicare Advantage plan. So it's something to consider, but I wouldn't keep me from taking a plan. I wouldn't necessarily pick a plan just based on the out-of-pocket limit, because not too many people actually meet it. If you were special needs and you had Medicaid and Medicare, maybe you know somebody, maybe you have a sibling, maybe you have someone in your family that is on Medicaid. So if you're on Medicaid and Medicare, it's what we call a dual eligible special needs plan. And these dual eligible special needs plans, they create special Medicare Advantage plans for them that are very rich in benefits, such as transportation. It gives them a significant amount of money to what you call over-the-counter benefits. I mean, some of them might have as much as over $200 for over-the-counter benefits per month for these people that are on Medicaid. And I mean, they even give you meals. Some of these plans give you meals. So there's really, they're trying really hard to help those people that are lower income on Medicaid. So a DSNP works, the Medicare is primary payer for Medicare's medical services, and Medicaid is secondary. So if you were on Medicaid and you had Medicare, you definitely would want to call national benefit plans or a licensed agent, because you would get more doctors. You would get, the advantage of going to the network and that Medicare plan, that Part C Medicare plan. It opens up a lot more doctors to you. So, DSNP also has these extra benefits that I kind of already went over, such as, dental, eye exams, transportation, over the counter. So I'm sorry I didn't go a lot over Part DSNPs, but I just kind of wanted to mention them because not everybody, we all might have somebody in our family that really could use a review of their Medicare plan. So you can buy, in addition to Part A and B, you have to have something for Part D, right? Part D is a standalone prescription drug plan. So you have two choices. You can either take the drug plan that's standalone, or you can take the Advantage plan that includes your Part D drug card. So this slide is not exactly correct. So I'm just going to kind of talk out of my head on this slide. So I wouldn't pay too much attention to stage 4, because there is only 3 stages now. So for 2025, unless you're going to be turning 65 and you need a December 1st effective date, everything will apply to you for 2025. For 2025, they've gotten rid of the gap stage. So there's only 3 stages now. There's a deductible stage where you might have to reach a deductible on your drugs, but most have a 0 deductible. There's an initial coverage stage, which means you'll have to reach a certain deductible or pay part of the drug costs, which in 2025 is $590. And then there's stage 4, which is catastrophic. Right now, catastrophic is only $2,000. So once you meet $2,000, you're out of the initial coverage stage and you're in the catastrophic stage, and you'll pay a set amount, so you won't pay anything for your drugs the rest of the year. And they have come up with what they call MM3, which is a plan where you can pay that $2,000 over 12 months if you need to. Some people might have to come up with the full $2,000 in month 1 or 2, and it might be a hardship for them. So they've created a way that you can actually, they call it M3P. But anyway, just wanted to mention that those are new for 2025. So the formulary list is something that I want to mention. It's really important because every plan has a different formulary. So the government requires that these Part C plans or Medicare Advantage plans have a list of covered drugs, and each plan must have at least 2 drugs in each category for each condition. So some plans might not cover 1 drug and other plans will cover a certain drug. Some plans, they also have levels, right? So they call stage 1 through 5. So your drug might be stage 1, which is a generic. Stage 2 is some higher price generics. Stage 3 are some brand names. So in other words, different plans might have the drugs on different stages or levels. And then in addition, they have different formularies. And every year the formulary change. So I would just preface this to you guys that if you're on a plan, and let's just say you're on the plan for 2024 and it's moving to 2025, you really have a contract for 1 year with that insurance company, because they have the right to change the formulary, they can change the co-payments, they can do some changes to that plan. They're going to send you an ENOC, which is explanation of coverage for the next year. So you'll get a big book that'll explain what's changing for you for 2025 if you're on a plan right now. And you can pay attention to that and you can see if it really still works for you, or you can work with a licensed agent, and that agent can help you every year to make sure that plan, basically you would call the agent might say, how did you do this year? Did you like the plan? You might say, yeah, it really worked well for me. I had no problems. The agent might say, this is changing, that's changing. Maybe your max out of pocket's going up by $1,000. And then you might say, wow, I think I can live with that. I'd like to stay on the same plan. Or we would completely put all your drugs in and completely look for a new plan. That's what you really should do when you're on a Part C or even a Part D plan. So Medicare supplement insurance or MedSup, or it's the same word as Medigap. So a Medicare supplement will cover Medicare covers 80%, a supplement will cover the other 20% of out-of-pocket expenses such as deductibles, coinsurance, and copays. So they're sold by private companies. They cover the gaps such as the Part A and B deductibles and the coinsurance, that 20% coinsurance. Just a special note here, they do not include Part D drug coverage. You have to buy that separately. And they do cover visits to doctors all the doctors that accept Medicare, you can go to with your red, white, and blue card. So just so you know that. Okay, well, let's see if we have any questions. I just want to say that was a really brief explanation. I do have a couple other presentations. We can keep you on the list and we can send you our upcoming presentations. My next one will be in January. So usually I do a different one every three different 3 months. So I'll have such a presentation of 20 things you might not know about Medicare next in January. And let's see. Sure, Susan, I can explain Part B again. Let's go over Part B. Trying to think if I have any other slides that I could show you showing you Part B. Let me just look at my PowerPoint.
You can enable her audio also if you'd like.
Okay. How do I do that?
Go to participants,
Okay,
attendees. Yep, a little higher.
okay.
And you can know how to talk. Not sure who asked the question.
Okay, so anyway, I
everyone.
did enable it, so Susan, you can talk if you want. Let me just explain Part B again. So Part A is hospitalization. Okay, so let's just say you're turning 65. You have when you get Medicare, you get Part A automatically. You can choose to take Part B, but if you're not continuing to work, you have to take Part B, because if you don't take Part B, they're going to charge you a 10% penalty for every year you don't have it. So Part B is what so let's just imagine that the government is in the early 60s or maybe 1958 or so. They're like, okay, we've got to help these seniors. So we're going to make Medicare. We're going to create a plan so that if they go to the hospital or if they need hospice care or skilled nursing, it's going to be covered. So they create Part A. Well, then comes along the early 60s and they're like, well, you know what? Maybe we should add something for their outpatient services. Maybe we need to add something for doctor visits, for drugs that are given in the doctor's offices, for outpatient surgery. So they create Part B, as in boy. Well, they're like, well, we can't really afford to give it to them for free, so we're going to charge them a premium for Part B. They still have to work the same amount of 10 years to get Part B to qualify. They still have to have their full retirement age unless they'll lose some of their Social Security benefits, but they can get everything. They can get their Medicare still at 65. They can postpone their Part B if they want till until they quit working, but they have to take it by age 70. So I'm not sure if I've explained it, but Part B is basically outpatient, and you're required to pay a premium for it. And you would use your Part B, for example, in a doctor's office, outpatient surgery. Where Part D is for the drugs, which is for the pharmacy and drugs. Let's just say you're hospitalized and they send drugs home with you. Those are Part D also. Let me know if that helped. Okay, great. All right. Well, I hope that I explained everything to you guys today. I really appreciate you joining me. I look forward to possibly seeing you again on another one of our webinars. And I really just want you all to reach out to me if you have any other questions, okay? And I want to say thank you for showing up, all right? And I'm going to go ahead and end the meeting, and I hope everybody has a fantastic evening. And I appreciate you so much. Thank you guys for coming. Still learning this system. Thanks for coming, guys. I'm going to go ahead and end the webinar.